When cancer patients, ALS families, and vulnerable kids become budget line items, it's not reform, it's cruelty in a lab coat. Let's rip the mask off this GOP backed efficiency charade.
Thank you.
This is a fun game we're playing.
Mr. Secretary, let's talk about clinical trials.
Questions and to ask questions and don't give me a chance to answer them. Don't give me time to answer them.
Well, maybe in some of my questions you can elaborate on some of that. I want to ask you about the clinical trials because she does have that up on her poster there. Clinical trials are the forefront of research, innovation, and oftentimes represent that last hope for cancer patients and other patients addressing chronic disease when traditional treatments have been effective. These clinical trials are often lead to getting life-saving drugs to the market. Has HHS or any sub-agency assessed the impact of patient access to clinical trials through the reorganization effort?
We are not cutting any clinical trials. We're not cutting any clinical trials. We're not cutting drug development.
Thank you.
Cutting administrative costs.
A question on indirect costs, because, you know, this is a biggie. When it was announced that that NIH announced it would cap indirect costs at 15% for research. We talked about this actually in our meeting. We talked about the possible adverse effects of this. And like I've heard from West Virginia University, Marshall University, which receives smaller amounts, but I've heard from everybody across the country in terms of the research. West Virginia University is a member of the Association of Public and Land-Grant Universities, and they are working along with schools and independent research organizations across the country to come up with a new model for indirect costs. Are you aware of this effort, and have you met with them to discuss their work?
I haven't met with them, but we are talking with lots of people about a new way to fund indirect
Are you aware
costs.
of the effort that's going on with a whole bunch of stakeholders that are trying to figure out a way to do this better?
Yes, we are, and Jay Bhattacharya is very interested in this. And as you know, Senator, there were some of the private universities that were abusing that. We had Stanford, which has tens of billions of dollar endowment that was using our money. We wasted $9 billion last year of NIH's budget on indirect costs. We're paying some of these universities up to 78%. That money was not going to research, not all of it. In the public universities, we are very much aware that those universities are using the money well, that it is absolutely necessary for them. And we're looking at a series of different ways that we can fund those costs through them, but not through the independent indirect cost structure, which loses all control, which deprives us of all control of how that money is spent.
Well, in my many conversations with a lot of the research, because I don't think anybody here wants to lose our valuable research, and I put you in that bucket as well. I do know there's a recognition that there's not enough transparency, that the system needs to change. And so this group that's being put together, I think, is very thoughtful in their approach. And I would encourage you, as you've already done with the head of NIH.
Yeah, and I'm happy, Senator Capito, I could talk to you right now in detail about some of the alternatives that we are considering. Okay. But we are taking it seriously, and we understand. But, you know, in Maine, at the University of Maine, the University of Alabama, many of these other state schools badly need this research. They're doing cutting-edge research, and they need that money that was going through indirect costs, but we think there's a better way to pay that out.
Okay. Well, we want to work with you on that. Let me talk about rural health. I mentioned it in my opening statement. I know you've been to our state, so you understand the rural nature of many of our states. You know, there's such significant healthcare challenges in rural America. A lot of it around access. The rates of chronic conditions like diabetes and heart disease are among the highest in the country in rural America. HRSA programs are critical to rural health and initiatives. And you've, in your budget, announced a cut to HRSA programs. I am concerned about that because of the access issue and because of the inequities that I think I see, and I think we see sometimes between where people have easier access to health care than in rural America. You got transportation issues, you have connectivity issues, you have just generational issues of passing down different diseases. How is rural America going to be better under your new reorganization?
There's a lot of ways, as you point out, under HRSA, and this is a priority for me. It's one of the commitments I made. When I was doing my Senate confirmation, it was the issue that was most often raised by the various senators who I talked to. These facilities, we're seeing an epidemic of closures in rural hospitals, rural areas around the country, and these not only provide critical access to care. If you don't have that hospital, people may have to drive 2 or 3 hours to get to a site, and that means people will die. They also are critical to the economy and the culture of rural America. They provide jobs and high-paying jobs, and they're economic drivers for those communities. So we're determined to keep them open and to do everything that we can to help them. And we're doing that through a combination of different ways under HRSA, through the community health centers, the National Health Service Corps, which provides badly needed personnel, which is a huge deficit in rural areas. The GME program, which does education for those through rural health, but also through innovations like to provide better health care through telehealth and through AI and through wearables and apps that can actually save people hospital trips. I spent 2 hours yesterday meeting with the CEOs of some of the biggest and most effective health tech companies in the country, and the potential that we have to transform rural health care. For me, I walked out of that meeting very, very optimistic and very excited about the capacity that we now have through technology and AI to transform, to save, to rescue rural health care around this country.
Thank you very much. Senator Durbin.
This section is a masterclass in gaslighting with a Harvard diploma. The secretary dodges cuts to clinical trials and spins administrative efficiency as a virtue, while conveniently forgetting that indirect costs keep the lights on at institutions doing real research. Public universities, already underfunded, are now accused of misusing funds, while billion-dollar corporations remain untouched. And when it comes to rural health care, the solution isn't policy, it's apps and wearables. Tech won't airlift a pregnant woman 150 miles to the nearest hospital. This isn't innovation, it's abdication. If this is the new model, rural America is being told to code its way out of collapse. Now, buckle up, because next comes the moral gut punch. A grieving senator, an ALS patient clinging to hope, and a government bureaucrat who acts like he's never read his own memos.
Thank you for being here, Mr. Secretary. Let me ask you a startup question. Do you know the #1 cause of preventable death in America today?
The #1 cause? Well, I know what the #1 cause of deaths is in this country. I'm not sure what you're talking about.
I'm talking about tobacco. You fired the head of the CDC's Office of Smoking and Health and eliminated their efforts from your budget. Hundreds of employees at FDA's Tobacco Center, including the director, have been let go. If we are genuinely concerned, and I believe you are, about the health of America and making it better, something as basic as the #1 preventable cause of death is not served by that kind of dismissal. Let me take you to another issue that I think is personal to me in a way. It reflects a tragic situation involving ALS. A friend of mine named Brian Wallach used to work in the Obama White House. And Brian met his wife-to-be, Sandra Abravaya, who was my press secretary. They married. When their second daughter was born, Sandra came home from the hospital to learn that her husband had ALS. Brian and Sandra have been fighting a battle now for 8 years. He's still alive. He can no longer walk or talk, but he has hope. He loves his family, and he's hoping that something will break through in ALS that gives him a chance for a future. Please explain to Brian and Sandra and their 2 young daughters why you've canceled ALS grants at institutions across this country, and why you think research for diseases like ALS should be cut by 40% next year.
Senator, I don't know about those cuts. I will have to, I don't know if that's true. I don't know if those were part of the rifts, in which case the people were not fired, but they were put on administrative leave. The issues that you're talking about are issues that are important to me: tobacco, ALS, and I know you have a passion for congenital heart disease as well. Those are all issues that I'm deeply concerned with, and I'm happy to meet with you at any time and talk about the programs and what we can do to make them better.
Of course, you're welcome, and I think the conversation is important. But I want to remind you, on April 1st, 10 laboratory heads at National Institute of Neurological Disorders and Strokes received their layoff notices. They were all PhDs and senior investigators. They're not administrators, whatever that might be. They were running intramural labs at NIH. If you have your way, they'll all be gone on June 2nd. Science magazine reported 25 of 320 physician researchers at NIH's Internal Clinical Center are leaving, and the number of patients treated in the hospital has been reduced by 30%. 3 grants involving ALS and dementia work at Northwestern University in Illinois have been paused. One looking at how to stop the buildup of damaged proteins, another looking at cellular mechanisms that can be drug targets. Just last week, an ALS researcher at Harvard had his grant cut that was using AI to accelerate the reversal of ALS symptoms. Brian Wallach is waiting for a cure. He is not giving up. His source of hope is this research that you unfortunately are terminating. How can we possibly address his concerns and give hope to people across the country who are suffering for so many diseases when our government is cutting back on that research?
As I said, Senator, I do not know about any cuts to ALS research, and I'm happy to meet with you.
I just read them to you.
Yeah, I will have to go and talk with Jay Bhattacharya and find out what the rationale was for those cuts. I just don't know about them until you told me about them at this moment.
There are many things that concern both of us about the state of public health in America. And questions you've raised, I think, are legitimate questions, many of them, that I want to follow through. I want to know the honest scientific answer to these questions. And I want to make this point. Cutting medical research is giving up on the future. You can't do that. These families are counting on you, Secretary, and counting on your department to do this research. It gives them hope to live another day. Just turning out the lights and saying you're doing it in the name of efficiency or DOGE or whatever it is no consolation to these families that are struggling. Thank you, Madam Chair.
This isn't just bureaucratic amnesia. It's institutional betrayal. Senator Durbin lays out a heartbreaking, fact-based indictment of a department slashing research into one of the most brutal diseases on earth, ALS. And what does the secretary say? I don't know. Excuse me? He doesn't know that 25% of NIH's physician researchers are leaving, that grants for life-saving AI research are being cut, that families like Brian Wallach's are watching hope evaporate in real time. Efficiency is the new euphemism for abandonment. This isn't belt tightening, it's a death sentence delivered by PowerPoint. If ignorance is policy now, then every family fighting disease just became collateral damage. From neglected cures to ignored outbreaks, the failures keep coming. Now let's talk measles, misinformation, and a bizarre defense of religious anti-vaxxers that would make science weak.
Senator Moran.
Thank you, Chairman. Secretary, welcome. Kansas, my home state, is one of several states that are facing the impact of a recent measles outbreak. We had 56 cases confirmed measles, with 54 cases being in a southwest part of our state. Among the 54 outbreaks, 48 of those patients were unvaccinated or had unknown vaccination status. Overall, the state's cases, 45 of those patients or victims of measles were children. What do you need? What do you need from us? And what can you do currently to be of help to the Kansas Department of Health and Environment in support of their response to ensure that this outbreak doesn't spread and to make sure that those who have been positive for measles are are cared for and this becomes a thing of the past, not a thing of the future?
Yes, Senator. The best way to prevent the spread of measles is through vaccination. We urge people to get their MMR vaccines. There are groups in this country that don't want to be vaccinated many of them for religious reasons. I spent a lot of time with the Mennonites, and the MMR vaccine has millions of fragments of human DNA in it from aborted fetal tissues, and that's a religious objection for them that I have to respect. We need to be able to treat people who do get sick, which the CDC does not give people advice, physicians advice on now until I came in, and we started a new program to treat people who actually get sick. We've done a better job at controlling measles since I came into this agency than any other country in the world. Today we're at 1,035 cases, and we only added 27 cases last week. Canada, which is 8%, 1/8 of our population, has a outbreak double that size, and they added 300 last week. Mexico, which has a population a third our size, has almost the exact number of measles that we do. Europe has almost 7,000 cases, so 7 times what we have. And they're growing and adding cases. We've deployed the epidemic intelligence services to all the states that have requested our help. We have people on the ground in those states, and they are doing a great job at limiting the spread of the outbreak. And if the governor of Kansas wants to contact us, we will deploy a team to Kansas to make sure that outbreak is curtailed there.
Do you have all the tools at HHS to be of help to Kansas and other states?
We do. We not only have tools like vaccination and the tracking and tracing and surveillance and analytics and lab support. We also now are for the first time are able to provide physicians with at least some treatment protocols so that when children do come to a hospital with measles, there's a protocol for treating them. Most children, virtually no child should die of measles. We've only had 4 measles deaths in 20 years in this country. And even before the introduction of the vaccine, the death rate for measles is about 1 in 10,000. So healthy children should not die from measles, and there's ways of treating most of the kids who died either have comorbidities, but in addition to comorbidities, they have bacteriological infections that are associated oftentimes with measles, and we need to give the physicians the tools to treat those bacteriological infections. And they have not had that. CDC has never given them those protocols because it's one solution only, and it has not been a good system.
You have demonstrated a support for people with developmental disabilities. Could you talk about that commitment to supporting the work of developmental disability networks and how the federal government can continue to support Americans with intellectual and developmental disabilities?
I mean, this is a lifetime passion for me, but also a family passion, and we will continue to provide that support and to provide the best science that we can.
And I want to follow up with something that Senator Collins said in support. I want to share my support for the BOLD Act, the Bold Infrastructure for Alzheimer's Act, and again indicate the value of the continued and intense effort of trying to find the cure and treatment for Alzheimer's. Anything you'd like for me to know?
Well, I alluded to this earlier on, but the NIH really went off the rails on Alzheimer's research 20 years ago. One of the favorite researchers, the part of the old boys club at NIH, developed a hypothesis that Alzheimer's was caused by amyloid plaque buildups. After that, NIH suppressed any science and refused to fund any science on alternative hypothesis. We are going to change that.
Today, fully committed toward the research to...
Yeah, absolutely. We're going to find what causes Alzheimer's, what is causing the epidemic of Alzheimer's, and we're going to find a cure.
Here it is, the Republican balancing act between science and pseudoscience. While children in Kansas get sick from a preventable disease, the secretary defends anti-vaxxers in the name of religious freedom. Respecting religious beliefs shouldn't mean sacrificing public health. He proudly claims America is beating measles because we're not as bad as Mexico. That's the bar now? He throws the CDC under the bus for not offering treatment protocols, then pats himself on the back for deploying his own team. This isn't leadership, it's a PR stunt dressed as policy. Measles outbreaks in 2025? That's not fate, it's failure, sanctified by cowardice. If you ever needed proof that this government is abandoning science in favor of spin, you just got 3 brutal chapters. Chapter 1. Cancer trials and rural hospitals are on life support. And the secretary's plan? Zoom calls and wearable tech. Chapter 2. ALS families are begging for a lifeline, while NIH scientists are being shown the door. The secretary can't even confirm the blood on his own hands. Chapter 3. Measles outbreaks are being met with a shrug and a sermon, while public health plays second fiddle to political theater. This is the GOP's vision of health policy: privatized, digitized, and lobotomized. They don't want oversight. They want optics. They don't want cures. They want cost-cutting headlines. And they're more than willing to let Americans suffer, so long as the spreadsheets stay clean. We cannot let this be the standard. We cannot normalize this level of neglect. If we do, the next wave of disease won't just be viral, it'll be political. Subscribe to Malcolm Varon Hearing. Share the outrage. Demand answers, because in this war on science, silence is complicity. And we're here to fight with facts, fury, and fearless truth.